Here is the latest legislative news from the Texas Hospital Association. May 1st, 2023. We've reached the final month of the Texas legislative session, with just 28 days remaining. And last week's activity at the Capitol likely represented a preview of the twists and turns the final month will have in store for THA, as both excellent legislation and troubling proposals advanced closer to becoming law, making it essential that hospital advocates stay attuned and involved. On the good side, the full Senate passed two measures tied to one of THA's foremost priorities, boosting and protecting the healthcare workforce. Senate Bill 840 by Senator Royce West to make it a third-degree felony to assault a hospital worker advanced out of the Senate on Wednesday, adding more force behind THA's push to shield workers from violence. THA testified in favor of that bill the previous week. More good news came that same day when Senate lawmakers voted out Senate Bill 2059 by Juan Chuy Hinojosa, which would establish several types of grant programs tied to nursing education, including clinical site nurse preceptor programs and innovative pilot programs. THA supported that measure in testimony the week before and also testified in favor of its companion bill last Monday, with Assistant General Counsel Heather De La Garza expressing support for House Bill 3930 by Representative John Bryant. Moving closer to full passage was the THA-supported Hospital Investigation Transparency Bill, House Bill 49 by Representative Stephanie Click. That bill, on which THA worked closely with the author to refine the language, was recommended for the Senate's local and uncontested calendar, meaning it should pass soon as a formality. Once that happens, House Bill 49 will be ready to head to Governor Greg Abbott's desk for his signature. THA's behavioral health agenda advanced in a big way Friday with the House's passage of House Bill 2337 by Representative Tom Oliverson to mandate Medicaid coverage for behavioral health partial hospitalization programs and intensive outpatient therapy. THA has strongly backed coverage for those programs to give behavioral health patients access to a full continuum of services, and a reinforcement for the Senate's prudent layperson standard for emergency care passed the House on Friday as well. House Bill 1236 by Representative Tom Oliverson passed by unanimous 147-0 vote. House Bill 1236 would clarify that insurers must provide coverage for emergency care based not on the final diagnosis, but on whether a prudent layperson would believe the medical event was an emergency. Unfortunately, along with those wins, advancement by several bad legislative omens for hospital business interests demonstrated the need for hospital advocates to remain vocal and vigilant all the way through to the legislature's adjournment. A surprise reconsideration by the House Select Committee on Healthcare Reform on House Bill 633 by Representative James Frank resulted in the committee voting favorably on the bill, just days after the same committee failed to advance the same legislation. House Bill 633 would force hospitals to accept a government-set maximum rate for all services provided outside of insurance, which would be tethered to the hospital's lowest contracted rate with any health insurer. That would incentivize patients to be uninsured, allowing them to obtain the lowest payment rate available. And THA is consistently opposed to any form of government rate setting in the private insurance market. In the midst of advancing some of THA's biggest agenda items, the Senate also approved a troubling series of restrictions on physician non-compete agreements. Senate Bill 1534 by Senator Charles Schwertner would limit non-competes for physicians and other practitioners to a 1-year time frame in either a 5 or a 10-mile radius depending on the population size of counties in the area. THA previously testified against the bill and restrictions it deems arbitrary. Senators also approved THA-opposed Senate Bill 490 by Senator Brian Hughes, which would introduce an onerous and expensive administrative burden for hospitals by requiring them to produce an itemized bill for patients accompanying every single payment request. THA has noted that along with the cost and time and expense for hospitals, patients would be confused by extensive paperwork they didn't ask for. As we enter the final stretch of the 2023 session, one key date in the legislature is just 10 days away. By the end of the House session on Thursday, May 11th, any bill must have been considered by that chamber on second reading. Any bill that fails to achieve that milestone will be dead. Keep that date in mind because the aftermath of May 11th will give THA and other hospital advocates a clear picture on what the legislative battles will look like during the final 2+ week sprint. Join us again next week for more updates from the 2023 session of the Texas Legislature.